when you look at the numbers about Americans, maybe a third or more of adults are obese. I think 1 in 4 has 2 or more chronic diseases. You see the data that says we spend more for less health than other countries, although, as you mentioned before, we're not Finland, where everybody's got the same issues and the same genes. But how do you go about then addressing the other side of the equation, which is Americans who aren't doing wellness prevention, aren't maybe taking care of themselves, aren't eating right, exercising? Corporations have a big role to play in this, right. And there's interesting things going on around that area. Johnson & Johnson itself has done a lot there, and there's companies all getting together to try to figure out. I get the emails from our company, here's something you should do to be well, and I don't know how many people pay attention to those, but how do you get a partnership between maybe employers and people to start into these areas where you're going to lose weight, you're going to quit smoking, you're going to exercise?
Yeah, well, look, I don't think there's a silver bullet. I think it's going to take a combination of approaches. And I think, some of the things I mentioned earlier. So how do we go from fee-for-service to episodic care, outcomes-based starts there. How do we better integrate some of the knowledge that we have in the systems? We're still incredibly disconnected in many ways. Yes, we have electronic medical health records. We're starting to make some of those connections, but I think that offers great promise. I think the third biggest area, though, is exactly what you mentioned. How do we prevent these things from happening in the first place? And how do we address them? Look, one of the best parts of my job is that I get to go into these rooms filled with remarkable scientists that can be talking about the next BTK inhibitor in lymphoma. I can walk into the next room and there's a bunch of engineers talking about, we're going to do an ultra, harmonic surgical instrument that can cut and coagulate at this kind of rate and reduce morbidities post-surgery. And I go into the next room and I see a Jennifer Aniston commercial on Neutrogena. So you really get to see the full spectrum. But if you get the scientists in a room, I think what motivates them most is how do we stop these things from ever happening? Because what our best oncologists will tell you is that by the time we can detect a tumor today, if it shows up on a CT or an MRI, the cells have probably replicated somewhere between 30 or 40 times. If they replicate about 5 or 6 more times, you're probably stage 4. And why can't we get to that at the 5th or the 10th? And to do that, what can we learn from whether it's genomics, whether it's our protein, whether it's DNA, RNA? How can we go from the cholesterol test that all of us take today as our numbers, and how can we have similar scans as it relates to things like oncology, Alzheimer's, and other, where we can intervene much earlier in the process and stop this cascade. And by the way, that cascade, it exists in cancer. It exists in Alzheimer's. We've invested literally billions of dollars in Alzheimer's, and one of the things we find is that we're probably intervening in the 8th inning. And it's far too late to really be able to make a difference. And here, too, look, I think some of it is our lifestyle. About 75% of many of the chronic conditions that ultimately end up taking most of us, things like cardiovascular disease, things like smoking, diabetes, things like that, are significantly influenced by what we do every day, what we are in our caloric intake, our activity level. Do we choose to smoke or do we not smoke? How do we manage stress? And it's something we're paying a lot of attention to. We're one of, we are an early company to invest in health and wellness. I got to tell you, it's a tough business. There's a diet and there's a gym just about on every corner. And doing it in a database, meaningful way and changing behavior is not easy. You probably know that with your families and your spouses. Mine would certainly say that. But it's got to be part of it. And look, we've been doing it at Johnson & Johnson for about 40 years. Jim Burke, several predecessors back, said, if we're the biggest healthcare company, we should be the healthiest healthcare company. And we've invested a lot in things ranging from the food we offer in our cafeterias, the things that we put, the gyms that we put. But more and more what we're finding is, well, how do we design the workplace to encourage people to stand up more, standing desks, to walk around more, little things? How do we make sure that they've got access to health and wellness programs now online all the time.
You have an app too, right?
Absolutely, it's a 7-minute app that you can do, so there's no excuse. And and also, how do we make sure, in some ways, that when people have an untoward event in their family, that frankly, they're managing the psychological part of it as well as the physical, because we know that those two are tied together. And ultimately, we believe that, look, if you create a healthy environment, if somebody can show up at work in their best state, they're going to be their best. And that's, the long-term impact that you can have on their health, that they can then have on the company, is directly correlated. But I think health and wellness prevention, intervention has got to be a big part of the long-term solution for healthcare.